Question: which of the following muscles inserts onto the neck of the condyle? A. Masseter. B. Temporalis. C. Medial pterygoid. D. Lateral pterygoid. The answer is D. Question: which of the salivary glands are purely mucus? A. Parotid gland. B. Palatine gland. C. Sublingual gland. D. Submandibular gland. The answer is B. Palatine glands are minor salivary glands that are purely mucus in secretions. Question: which of the muscles listed below are innervated by trigeminal nerve? A. Buccinator and masseter. B. Tensor and levator veli palatini. C. Medial and lateral pterygoid. D. Anterior and posterior belly of digastric. The answer is C. The medial and lateral pterygoid muscles are innervated by trigeminal nerve, which is cranial nerve 5. Levator veli palatini is innervated by cranial nerve 9 and 10. The posterior belly of digastric is innervated by cranial nerve 7. Question: which ligament restricts posterior movement of the mandibular condyles? A. Stylomandibular. B. Temporomandibular. C. Anterior cruciate. D. Pterygomandibular raphe. The answer is B. Temporomandibular ligament is also called external lateral ligament. It functions to limit posterior displacement of the TMJ condyle and limits excess downward movement of the mandible. Question: which anatomic structure listed below will be affected by injury to facial nerve after it exits the skull through stylomastoid foramen? A. Mylohyoid muscle. B. Masseter muscles. C. Submandibular gland. D. Posterior bell of digastric muscle. The answer is D. Facial nerve exits the skull through stylohyoid foramen. It innervates many structures, including posterior belly of digastric muscle. Question: which nerve listed below is associated with submandibular ganglion? A. Maxillary. B. Inferior alveolar. C. Mylohyoid. D. Lingual. The answer is D. The submandibular ganglion is associated with lingual nerve. The submandibular ganglion is a parasympathetic ganglion with its preganglionic fibers coming from chorda tympani nerve. Question: the middle meningeal artery enters the cranium through which foramen? A. Foramen ovale. B. Foramen rotundum. C. Foramen spinosum. D. Foramen lacerum. The answer is C. Middle meningeal artery is a branch of maxillary artery. It enters the cranium through foramen spinosum. Question: which ligament attaches to the lingula of the mandible? A. Temporalis. B. Sphenomandibular ligament. C. Stylomandibular ligament. D. Temporomandibular ligament. The answer is B. Sphenomandibular ligament. Question: which of the following muscles inserts onto the neck of the condyle? A. Masseter. B. Temporalis. C. Medial pterygoid. D. Lateral pterygoid. The answer is D. Question: what is the mechanism of action of bisphosphonate? A. Inhibition of osteoblastic bone resorption and remodeling. B. Inhibition of osteoclastic bone resorption and remodeling. C. Rank ligand inhibitor. D. All the above. Answer is B. Question: what is the most common type of seizure seen in dental office? A. Jacksonian seizures. B. Psychomotor seizures. C. Generalized seizures. D. All the above. Answer is C. Question: what is the primary source of pathogens in a dental operatory? A. Light handles. B. Dust particles. C. The mouths of patients. D. The hands of clinicians. Answer is C. Question: which local anesthetic nerve block injection is associated with the greatest risk of hematoma formation? A. Mental nerve. B. Greater palatine nerve. C. Inferior alveolar nerve. D. Posterior superior alveolar nerve. Answer is D. Posterior superior alveolar nerve block injection is associated with the greatest risk of hematoma formation. Question: what type of tissue covers the articulating surface of temporomandibular joint? A. Bone. B. Hyaline cartilage only. C. Synovial membrane. D. Dense fibrous connective tissue. The answer is D. The articular surface of TMJ is covered with tough fibrocartilage. Fibrocartilage is made up of dense fibrous connective tissue and hyaline cartilage. Question: what structures are found in infratemporal fossa? A. Temporalis muscle and parotid gland. B. Masseter and lateral pterygoid muscle. C. Superficial temporal artery and parotid lymph nodes. D. Mandibular division of V and chorda tympani. The answer is D. Mandibular division of cranial nerve 5 and chorda tympani branch of cranial nerve 7 are found in the infratemporal fossa. Question: what muscle is affected by a fracture of the hamulus? A. Buccinator. B. Tensor veli palatini. C. Levator veli palatini. D. Superior constrictor of the pharynx. The answer is B. The tendon of tensor veli palatini muscle wraps around the pterygoid hamulus. The tensor veli palatini tendon and the hamulus form a pulley that changes the shape of the soft palate. Question: what muscle of the oropharynx causes folds in the posterior wall of the pharynx? A. Musculus uvuli. B. Tensor veli palatini. C. Levator veli palatini. D. Palatopharyngeus. The answer is D. The palatopharyngeus muscle is a paired muscle located in the upper part of the throat, also referred to as the pharynx. Palatopharyngeus belongs to soft palate and the pharyngeal muscle group. Question: what bone contains openings through which trigeminal nerve exits the cranium? A. Frontal. B. Sphenoid. C. Temporal. D. Occipital. The answer is B. The three divisions of trigeminal nerve exit the skull through foramen and the sphenoid bone. The sphenoid bone is part of cranial base of the skull,